things that we usually would talk about when it comes to the different aspects that we do in the community, okay, and in the hospitals, as well as different parts of or areas of practice of pharmacy. So let me just give you a run through of my discussion on this topic on the use of secondary metabolites in the prevention of non-communicable diseases. We'll just give a little introduction, okay, or hopefully we will have a little enlightening on the burden of the disease, particularly on the WHO data on non-communicable diseases. Then we'll have to present with you to you the importance of secondary metabolites. You can go to the next slide now. Then secondary metabolites, okay, we'll try to have a detailed discussion on that in the prevention of non-communicable diseases. Some of the secondary metabolites that I will be discussing or presenting with you are these three class of secondary metabolites: phenolic compounds, terpenes, nitrogen-containing compounds. I hope I had also included sulfur-containing compounds. And we'll look into also some related studies regarding the utilization of secondary metabolites and researches that have been conducted in line with the prevention of NCDs. No? So after that, I will have a little conclusion, so summary and conclusion to end my sharing. Okay, so for the next slide, okay, let's look into the burden of the disease. Okay, for coming from the World Health Organization, it says here that the non-communicable diseases, which is which account to the cardiovascular diseases, such as those in heart disease and stroke, cancer, diabetes, chronic respiratory diseases, okay, would cause nearly 3/4 of deaths in the world. No? And that would now be equivalent to the NCDs killing 41 million people each year. 74% of all deaths globally. And each year, 17 million people die from an NCD before age 70. So that's what we call as premature NCD mortality. Okay, dying before the age of 70. 86% of this premature deaths would occur in low and middle income countries. Okay, and when you look into the data, it says also in the WHO site that the risk factors, 80% of the risk factors of premature deaths would come from these cardiovascular diseases, such as heart disease, stroke, and diabetes. But these could be now prevented. Okay, and one of the things that I'd like to share with you is the WHO objectives, or I could say strategies, when it comes to the prevention of non-communicable diseases, prevention and management of non-communicable diseases. Let's go to the next slide. Okay, WHO enumerated 6 objectives, or I could say strategies that would manage the non-communicable diseases. First is the setting of the priorities, raising priority and integrating prevention and control into policies of the government down to the local government units. Second is onto the leadership. There is a need to strengthen establish national policies and plans when it comes to the prevention of NCDs. Third is on the interventions, focus on shared modifiable risk factors. The WHO would like to look into what are the risk factors that can be modified and eventually plan and do interventions relative to that. The fourth one is into the researches, conduct of researches. The WHO promotes research for NCD prevention and control. Okay? And that's what we will have to zero in a little while. Partnerships are also mentioned, okay, wherein there is a need to promote partnerships, okay, for NCD prevention and control. And the last one is into monitoring and evaluation. Okay, there is a need to monitor NCDs and its determinants, and eventually evaluate the progress of the different interventions that have been employed. Okay. So in this set, we would look into now the different researches, okay? And one specific research that has captured my attention into the NCD prevention and control, okay, is that of okay, may we go to the next slide? Okay. Is into the bioactive plant metabolites. No, it's specifically looked into the different opportunities, no, beyond the conduct, no, or the management of NCDs in so far as plant metabolites are concerned, the use of plant metabolites is concerned. So I'd like to refer you to this highlighted text here, or portion of the abstract of the study. Okay, it says here that there has been an unprecedented worldwide rise in non-communicable metabolic diseases, particularly cardiovascular diseases and diabetes. While modern pharmacotherapy has decreased the mortality in the existing population, it has failed to stem the rise. No? Further, a large segment of the world population cannot afford expensive pharmacotherapy. Therefore, there is an urgent need for inexpensive preventive measures to control the rise in CVD and diabetes and also other associated comorbidities. This is one of the reasons, no, why there is a need to conduct researches along the secondary metabolites to curb the cost or the out-of-the-pocket expenses of different patients when it comes to their expensive pharmacotherapy. Okay, so imagine that the pharmacotherapy would last for months and even years, and that would really be expensive to our patients. Hence, there is a need now to look into other alternatives, which are considered to be less costly and available, no, in our those that we can just simply consider as part of our diet. Okay, and this study also re-echoed or in line with the objective of the WHO when it comes to the conduct of research for NCD prevention and control. All right, so we go therefore to looking into what are the different secondary metabolites that we can work on when it comes to prevention and control of NCDs. Okay, so go to the next slide. Secondary metabolites, no, according to Amitabha Bhattacharya, okay, are useful natural products that are synthesized through secondary metabolism in plants, and they play significant role in plant adaptation to various environmental constraints that not only influence plant growth but also alters the biosynthesis of secondary metabolites. Okay, Dr. Yung Sun Theo in his study in 2015 also characterizes or defined secondary metabolites as substances manufactured by plants that make them competitive in their own environment. And these are now described as the small molecules that exert a wide range of effects in plant itself and on other living organisms. For its corresponding functions, no, secondary metabolites do act as competitive weapons against, okay, we can go to the next slide now. They are considered as weapons of the plants, no, against other bacteria or other plants, fungi, amoeba, plants, okay, insects, and large animals. Also, they act as metal transporting agents, okay, are agents of symbiosis between microbes and plants, and that of nematodes, insects, and higher animals, okay, sexual hormones, and also differentiation effectors. However, in this particular presentation, we would be focusing on the use of secondary metabolites insofar as its prevention and control potentials, okay, prevention and control of NCD potentials are concerned, okay. Next slide. Okay, so we look into the different classes of plant metabolites. Okay, so secondary metabolites, okay, are there are three major classes of plant metabolites based on biosynthetic pathway. I have included in here though the sulfur-containing compounds. The major classes of plant metabolites based on biosynthetic pathway would include the terpenes, okay, and of course some steroids under that, which are composed mainly of carbon and hydrogen, no? And the phenolic groups, okay, or the phenylpropanoids, okay, composed of simple sugars and benzene rings, okay, and then we have nitrogen-containing compounds, and then had added sulfur-containing compounds. No, so some examples of these secondary classes of secondary metabolites are listed in there. Okay, but we will have to go into this specific examples in a little while. Okay, next slide. Okay, so the first one in the class of plant metabolites is the terpenes. Now, we say that the terpenes are the largest, the most diverse group of plant secondary compounds. The name terpene, okay, it is interesting to know that it is derived from the word turpentine. Okay, and they are all derived chemically from 5 carbon isoprene units assembled in different ways. Okay. Okay, so for its characteristics, there are structurally diverse and large metabolite group, okay, with at least more than 35,000 different terpenes, characterized to date. The terpenes consist of the isoprene, okay, units that can be modified by cyclization reactions, making them easily recognizable. They are also classified in different groups based on the number of isoprene units in their carbon skeleton. Okay, these are just to show you the different examples, or different types of terpenes, okay, and the corresponding analog terpenes. They have different the terpenoids, the analog terpenes, the number of isoprene units, okay, so you could easily identify them based on their chemical structure, okay, and the number of carbon atoms. Okay, so terpenes are colorless, though the impure samples are frequently yellow. But in terms of its boiling point, terpenes, sesquiterpenes, diterpenes are usually higher than the boiling point of water, 100, 160 to 20 degrees Celsius, respectively. They are considered to be insoluble in water due to their non-polar nature, okay, and insoluble, okay, are highly combustible and have low specific gravity. Therefore, they do float, no? Okay. All right, so let's look into some examples of terpenes. I hope we do have some time to look into this one. But anyway, we'll just have to make it as quick and brief as possible. No? So for the types of monoterpenoids that I had prepared for the discussion, examples of which are camphor, eucalyptol, menthol, and thymol. I think we are all quite familiar, and we would usually encounter these types of monoterpenoids or terpenes in our pharmaceutical preparations. Okay, and also in some galenicals. Okay, so we go to the camphor. Now, camphor is also known as gum camphor or Japan camphor, Formosa camphor, laurel camphor. So you look into its chemical structure over there, the upper right portion of the slide. It occurs in all parts of the camphor tree, Cinnamomum camphora, belonging to the family Labraceae. When it comes to its uses, you can see that there are a lot. It's not concentrating on its use in NCDs, but I have also included in here its pharmaceutical use and other benefits, relative to some communicable prevention of communicable disease as well. But looking into the different uses, we can see that camphor is really beneficial, especially when it is employed as a safe and effective measure of reducing cough. When applied externally in the form of an ointment in the chest and the throat of children, and it exerts its stimulant, trebifacient, and antispasmodic and analgesic activities as well. It stimulates the nerve endings in the skin and causes substantial relief of pain. So that's why it's used as an analgesic. The next is eucalyptol. Eucalyptol is obtained from the leaves of Eucalyptus globulus. It is used internally as a stimulating expectorant to relieve severe cough and in bronchitis, and in the form of inhalation. So the preparation for eucalyptol is through inhalation dosage forms. Abundantly employed externally as a mild anesthetic and antiseptic for the treatment of various inflammatory conditions. It also finds its use as decongestant nasal drops, and it is profusely used in room sprays, lotions, and all types of cosmetic preparations. And as a flavoring agent in pharmaceutical preparations, such as mouthwashes and gargles. So for NCDs, you can see, it has, it can be used, for conditions relative to respiratory ailments. Next. Menthol, menthol on the other hand is found in the peppermint oil, obtained from the fresh flowering tops of Mentha piperata. It is mostly used in mucous membranes or on the skin. It serves as a counted irritant, antiseptic, and as mild stimulant. It is employed in conjunction with other allied substances, those mentioned a while back, camphor and eucalyptol, in various pharmaceutical preparations such as expectorant, nasal sprays, and inhalants. So one thing that you could see as a benefit for menthol is its use in the management of respiratory conditions. At a lower concentration, let's say 0.1 to 1% when applied to the skin, it helps in the dilatation of the blood vessels, affording a cold feeling, followed usually by a depression of the sensory cutaneous receptors, thereby exhibiting an antipyretic action. So this is perhaps could be the reason for its logical inclusion in formulations meant for treating sunburns, minor burns, douche powders, athlete's foods, and some in the management of poison ivy rashes. Thymol. Thymol is obtained from the essential oil of Thymus vulgaris, and it is used as antifungal, antibacterial agent. Analgesic, it could also be a component of several analgesic and topical antiseptic formulations in low concentrations, okay, especially in personal health care products. Okay, so I also have included here, it's a pharmaceutic use in mouthwashes, gargles, oral preparations. So you may find thymol, no, in your preparations containing in your mouthwashes, gargles, and other oral preparations, especially if there is a local anesthetic action, no, in the management of toothache. Okay, all right, so the next terpene group is sesquiterpenoids. Okay, examples of this would be parthenolide and matricarin. No? Parthenolide, let's look into the biological source and the uses of parthenolide. Parthenolide, it is obtained from the leaves of Tanacetum parthenium, belonging to the family Asteraceae, though there are also other sources, no, of this terpene. It is found to act as a serotonin antagonist, okay, thereby causing an inhibition of the release of serotonin from blood platelets. Okay. Based on findings conducted by an elaborate double-blind placebo-controlled clinical trial, it has been established that the drug is significantly effective in the prophylaxis of migraine, no, by reducing considerably the severity as well as the frequency of the pain due to headache. Okay, in normal doses, let's say 125 milligram per day, or a good quality dried leaves, it's used in the therapeutic practice as a antipyretic or febrifuge. For the second example, matricarin, no, matricarin is obtained from the dried flower heads of Matricaria camomilia. You can go to the next slide now. And Artemisia thylaceae. Okay, the uses of Matricarin, no, since it would be, no, usually when would be taken from family Asteraceae, it represents a drug that is termed as German chamomile, and we know that a chamomile has a claim to be one of the or not, no, the most populous herbal tea in the United States because of its definite anti-inflammatory and antispasmodic therapeutic properties. Okay, the infusion or the tea, when consumed over a long span, will result into a cumulative overall positive effect, okay, which certainly justifies its age-old usage as a unique home remedy. Okay, and as a healthy beverage, not only in the Europe, no, but also in the United States. Okay. Other terpenes, in the group of terpenes, we have colfercine and ginkolide, and we also have, I think that's Taxol over there, no, apologies. Okay. Colfercine, okay, or forxcolline, is obtained from the root of Coleus forxoki. And it possesses significant therapeutic potential in diseases like congestive cardiomyopathy, okay, and also bronchial asthma, okay, wherein the excessive long-term usage of the beta-adrenergic agonist drugs such as propranolol, labetalol ultimately results into the desensitization of the receptors and a loss of drug efficacy. Okay, so therefore, this colfercine, no, is a very significant agent, no, in this life. It also finds enormous use in glaucoma and hypertension. So you see the very beneficial use of colfercine when it comes to NCDs. Ginkolide B, okay, it is obtained from the root, bark, and leaves of Ginkgo biloba, belonging to the family Ginkgoaceae. For its uses, to say the standardized dehydrated acetone water extract of the dried leaves, equivalent to 6% terpenoids and 24% flavon glycosides, is sold commercially in Europe as an approved drug to enhance blood fluidity and circulation. Okay. When it is in a tablet containing 40 milligrams of the ginkgo, okay, it's allowed to be sold as a dietary supplement. Okay. Ginkgolides A, B, C, and M have been shown to check the platelet activating factor, thereby preventing bronchoconstriction, hypotension, cutaneous vasodilation, and finally the release of inflammatory compounds. Okay, for the Taxol, okay, or we would know it as Taxol or Taxol A. Okay, it is obtained from the bark of the Pacific yew tree, belonging to the family Taxaceae. Taxol is primarily employed in the treatment and management of metastatic carcinoma of the ovarian glands after the failure of follow-up chemotherapy. It is used in the treatment of breast cancer, usually after the observed failure of combination therapy, chemotherapy of metastatic disease. So, well, Taxol may not be used as a preventive agent, but it is a very significant agent that is used in the treatment and management of carcinoma, metastatic carcinoma for that matter. Okay. The next one is, let's see, what else we got here. Okay, we just have to go for the next one. Okay, triterpenoids, cucurbitacin B. No, I had picked only those examples that are so far related to the discussion on NCD prevention. Okay, so for the cucurbitacin B, cucurbitacin B is obtained primarily from most plants belonging to the Cucurbitaceae family. Okay, it has anti-neoplastic and anti-gibberellin activity, and those that have this plant have been employed as vermifuge, narcotics, emetics, and anti-malaria. They have also been implicated in sporadic livestock poisoning, okay, in South Africa. Tetraterpenoids, or vitamin A rather, okay, is the next type of terpene. Okay, and vitamin A, we see that it's mostly abundant in our diet, okay, particularly in fish liver oils, okay, dairy products, okay, such as butter, cream, whole milk powder, cheese, okay, and also in animal organs. For its uses, okay, particularly useful in the proper maintenance of vision, okay, growth, and tissue differentiation. The vitamin is employed mainly as a prophylactic where there exists an insufficient normal dietary intake. It also helps in the synthesis of specific glycoproteins. There are two vitamin A derivatives that I'd like to particularly discuss by virtue of the fact. All right, so synonyms of 13,6-retinoic acid, okay, include isotretinoin, okay, isotrex, Accutane, and roaccutane. It is used in the acute recalcitrant cystic acne, okay, and it also is invariably employed in keratinization disorders of the skin that are mostly pre-neoplastic. Okay, for all trans retinoic acid, or we would commonly know it as tretinoin, okay, it is generally used for the treatment of acne vulgaris. Okay, you could find it in some of our creams, solutions, and gels, okay, that is meant to be applied topically. Okay. All right, looking into vitamin A closely, vitamin A is is a term that's applied to all derivatives of beta-ionon other than the carotenoids that possesses the biologic activity of all trans-retinol. But I'd like to say that the retinol is a major non-natural form of the vitamin. Okay. Other known forms include the acetate and palmitate esters of the alcohol, and such oxidation products such as retinol, retinoic acid, and the 3-dehydroretinol. Vitamin A is exclusive to animals. The plant pigment beta-carotene can serve as a precursor. The cleavage of beta-carotene yields two vitamin A active species. So we had discussed any beta-carotene that doesn't belong or that doesn't become vitamin A is now used as an antioxidant. Okay, so that's why if you would see some studies that are related to the antioxidant property of vitamin A, it's related to this. Okay, so I think we can skip this part when it comes to the method or the preparation of determination of the beta-carotene in our sample solutions. So we may go to the functions. Okay, retinol, okay, primarily. Okay, is a part of the rhodopsin involved in night vision. So you see that, as I say, it is very important when it comes to maintaining our vision, also growth and tissue differentiation, of course. Okay. When it comes to the primary natural sources of vitamin A, okay, we have products coming from animals. Okay, you can see it's coming from liver or egg yolk or dairy products, and plant products. Also, some are vitamin A can be found in the oranges, red-colored fruits and vegetables, and also in our green leafy vegetables. Okay. Yeah, this is not to promote or something, but it's just for information of everyone, not availability or the available preparations of tretinoin or isotretinoin, okay, in the market, okay, particularly those that are applied topically. Okay, so available as cream, gel, and solution that is to increase epidermal cell mitosis and epidermal cell turnover. As we said a while back, it is used to treat acne vulgaris for our tretinoin. Okay. However, with the isotretinoin, it is available for oral use. We say that it is contraindicated. Okay. To women who are in their pregnancy period. And now we could see also that there had been interaction of vitamin A or isotretinoin when it comes to some oral contraceptive pills. Okay. Yeah, I think you're very much familiar with the deficiency associated with vitamin A. Okay. Of course, we look into first the dietary allowance, the recommended dietary allowance of vitamin A before we looked into the deficiency. But nonetheless, deficiency of vitamin A would be associated with poor night vision or poor skin health, and also cell differentiation, particularly in our bones and skin. Okay. Considering that vitamin A is a fat-soluble vitamin, therefore we would look into its toxicity level. Okay, it's 10 milligram. Acute toxicity of vitamin A, okay, would now manifest an increased intracranial pressure or hydrocephalus. For chronic toxicity, though, okay, there would be a hypervitaminosis A syndrome, which is characterized by fatigue, night sweats, abdominal discomforts, anorexia, vomiting. Okay. Okay, this is just to share with you. No, in the Philippines, we have this statutory law, Republic Act 8976. We call it as a food fortification law. It was enacted into law as 2000. There is a requirement, a government mandate, no, that there's need to fortify the staples, okay, to address micronutrient deficiencies of the Filipino diet. Okay, so we would be required, or manufacturers, okay, are required to say mandatory, no, fortification of the staples, okay, like rice, also with our salts, no, it had to be iodized salt. And for those products, okay, we say, or manufacturers who are processing food products, there is this voluntary certification, no, that is also recommended to them. Okay, that is just initiative of the government to address micronutrient deficiencies in the Philippines. All right, so the second class of secondary metabolite is the phenylpropanoids. Okay, phenylpropanoids represent a large conglomerate of natural occurring phenolic compounds, essentially derived from the aromatic amino acids phenylene and tyrosine, and in certain specific instances, the intermediates obtained from shikimic acid biosynthetic pathway. Distinctively phenolic in character, so as you can see, this is the aromatic ring, no? And you can see that there is a presence of, could be one or it could be several, no, hydroxyl groups attached to it. Okay, they are more often known among the phytochemists as plant phenolics. Okay, so phenolics, they are mainly distributed in plant kingdom. They are considered to be the most abundant secondary metabolites in plants because it comprise 40%. Okay, 40% soluble proteins of plants. Okay, an example of a phenolic, let's say polyphenol for that matter, is lignin, and is considered as the second most abundant compound in plant. More than 8,000 structures of the phenolics are known, and sources of phenolics would include some fruits, vegetables, cereals, no, legumes, olive, chocolate, tea, coffee, and wine. Okay. Okay. You can go to the next slide. Sorry for that. All right. So for its examples, okay, we have here just the next slide. Okay, phenolic compounds, okay, it could be classified into polyphenols and simple phenolics, and look into examples of polyphenols, such as we have tannins, flavonoids. For simple phenolics, also subclassified into phenolic acids and coumarins. Okay, phenolics can either be hydroxybenzoic acid or hydroxycinnamic acid. So as you can see in the tabulated portion, in the right portion of the slide, I have given examples of each classification. We have synaptic acid for hydroxycinnamic acid. We've got soralen, no, for coumarin, lignan. We do have etoposide, periposide, okay, and flavonoids. Okay, so we have silibin. For high molecular weight phenolic compounds, okay, we have lignin and tannin. No? So lignans, okay, we just have to simply differentiate. Now, lignans are plant products with low molecular weights, but we had the lignin considered as compounds, okay, phenolic compounds that would have a high molecular weight. Okay, cinnamic acid, okay, is obtained from the leaves and twigs of Viscus albium, okay, or known as the European mistletoe. It is used as an antiseptic, anti-spasmodic, and emetic. It was also employed for arteriosclerosis, cardiac stimulant, hepatosis, and hypertension. It also finds its use in epilepsy, hysteria, and nervous debility. For Soralen, on the other hand, is our example for coumarin a while back. It belongs to one of a group of coumarins occurring naturally in more than 2,000 different plant sources. Okay, we have from the family Ritaceae, okay, Umbelliferae, okay, and Leguminosae, and Moraceae also. Okay, there are also other sources of sorrelin, but nonetheless, it is used in the treatment of epidermal patches. Okay, sorrelins have also exhibited photosensitizing and phototoxic effects in animals and human beings, and hence have been employed extensively in photochemotherapy for the treatment of vitiligo, psoriasis, and mycosis fungoids. For etoposide, okay, etoposide is semi-synthetic podophytotoxin structural analog used as an anti-neoplastic agent. It is employed in combination with other chemotherapeutic agents for refractory testicular tumors. It is used as a first-line treatment in small cell lung cancer. Okay, so you can see that its benefit. It finds its benefit in the management of cancer, tumors, okay, and some lymphomas and sarcoma. Okay, so very essential. Okay, this etoposide. Okay, silibin. Okay, silibin is what we commonly know as silimarin. Okay, it is obtained from the seeds of milk thistle or Silybum marianum, okay, belonging to the family Asteraceae. Silibin is most importantly and widely employed as a therapeutic agent for protecting liver cells in situ, okay, or those not yet irreversibly damaged by acting directly on cell membranes. Okay, this is to prevent the entry of toxic substances. It also augments and stimulates the protein synthesis, okay, anabolism of proteins, thereby accelerating the progress or the process of regeneration and the production of hepatocytes. It also has been experimentally proven that silibin binds specifically to a regulative subunit of the DNA-dependent RNA polymerase, okay, at a particular site, okay, mimicking a natural steroidal effector and thereby causing an activation of this enzyme. So, well, consequently, the synthetic rate of the ribosomal RNA is increased considerably, okay, thus leading now to an enhanced formation of intact ribosomes that would ultimately give rise to an increased protein synthesis. Okay. So again, it is a supportive treatment for the management and cure of chronic liver conditions. Nitrogen-containing compounds we have alkaloid cyanogenic glycosides. We have here for alkaloids, okay, these are a group of naturally occurring chemical compounds. You can go to the next slide now. That contain mostly basic nitrogen atoms, which are derived from amino acids. Okay, they are all basic in reactions, usually bitter in taste. Most are colorless, except that of berberine, which is yellow. Okay, crystalline non-volatile solids, but some are liquids at ordinary room temperature. Okay, generally insoluble, okay, or poorly soluble in water, but be soluble in most of the organic solvents. So I just have listed here, the different examples of alkaloids. There are various schemes for the classification of alkaloids. Okay, in different references, you could look into some textbooks. They had to present it in various schemes, but I'd like to present to you, the following based on the ring structure, okay, or the nucleus. Chief alkaloid group in the plant drug. Okay, or not. It could be the pathway from which these alkaloids are derived. Okay, so there are two slides here that I have prepared just for you to look into the different examples, of alkaloids. So you see how how plenty they are, and the classifications. You see how extremely heterogeneous the group could be, okay, composing of high molecular weight compounds. Okay, I think we can go to some examples, specific examples. Let's have just try to look into some few prepared ones. Let's see, quinine, for example. Now it is obtained from the unripe, fully grown dried fruits of Conium maculatum. Okay, externally, quinine salts are used as ointments and infrequently employed for their local analgesic action in the symptomatic relief of pruritus, hemorrhoids, and fissures. Okay, you can look into some slides now. Ephedrine, on the other hand, okay, this is an example of the phenylalanine-derived alkaloid. The levoephedrine is extensively used as a bronchodilator. You can proceed to the next slide now. Again, next. Okay, we are already on ephedrine. Okay, the levoephedrine is extensively used as a bronchodilator, and the dextrosudoephedrine is one employed widely as a decongestant. Okay,
I'm sorry, ma'am. It is 5 more minutes left for presentation.
Okay, thank you for that. Aconine, possibly we can look into its use as in the treatment of neuralgia, sciatica, rheumatism, and inflammation. Also employed as analgesic and cardiac depression. Okay, so there are a lot of alkaloids present in our plants, okay, and some of these are really useful in the management of non-communicable diseases. You can jump into the cyanogenic glycosides. Okay, cyanogenic glycosides. Okay, cyanogenic glycosides. These are those that we say would yield either hydrocyanic acid upon hydrolysis, or they essentially possess a hydrocyanic acid in the glycol moiety. Okay, and we would designate them as cyanophore glycosides. For its uses, you can go to the next slide. Okay, we have here examples. Okay, so examples of specific examples and the corresponding uses of this type of plant metabolite. Okay. For the sulfur-containing compounds, I have just enumerated here 3 examples: allicin, cinegreen, and the glutathione molecule. Okay, allicin is found in garlic. Okay, cinegreen, in the other hand, is found in mustard, black mustard seed. Okay, 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 and some of the studies related or would now intensify the use of these sulfur-containing compounds when it comes to the management of non-communicable diseases. Okay, is that written? No, can go to the next slide by Alessandro Vendini. It says here that the sulfur-containing secondary metabolites could act as a neuroprotective agent, particularly that of the allicin found in garlic. Okay. The glutathione, on the other hand, is used in the prevention of cardiovascular diseases, acting as antioxidants. Okay. And I have also here some related studies pertaining to other secondary metabolites, those that would be going to show you evidences of the importance or benefits of secondary metabolites when it comes to the prevention of cardiovascular diseases, cancer, and respiratory diseases. For cardiovascular diseases, we have those in so far as antioxidant, anti-inflammatory, anti-aging effects, and those containing anthocyanins act as protective effects on cardiovascular disease-related dysfunction. Then we have cancers, those coming from berries. There are studies that have already been conducted that would give us evidence that berries could give or could exert therapeutic and preventive effects against colon cancer by the suppression of inflammation, oxidative stress, proliferation, and angiogenesis. For berries could also be used as a chemopreventive and therapeutic agent for cancers, including breast cancer. For respiratory related conditions, there have been studies that would now look into flavonoids, lignans, tannins, triterpenes. And these are those secondary metabolites that they had considered to be particularly beneficial when it comes to respiratory conditions, management and prevention of respiratory conditions. Phytochemical analysis were also carried out in the Philippines. One of our researchers from the University of the Philippines, when they had conducted phytochemical profile of some selected Philippine plants used to treat asthma. So there have been the identified secondary metabolites pertaining to saponins, terpenoids, flavonoids, and cardiac glycosides. And they had identified these are the ones responsible for the anti-asthma activity of the plants. Several studies also have been attributed to ginkgo biloba. Ginkgo biloba is used for to reduce. It is useful in reducing most acute lung injury, or ALI. And we have also the Ficus ticoa, or the perennial woody vine in the Moraceae family. Said that this medicinal plant contains beneficial secondary metabolites that would now contain flavonoids, phenolic terpenoids, steroids, coumarins, and alkaloids. The beneficial when it comes to the treatment of diseases such as chronic bronchitis, diarrhea, dysentery, rheumatism, and other inflammation-related diseases to some parts. So in essence, I'd like to leave you with this summary, that the use of secondary metabolites has really been in effect for quite some time in the management of NCDs, and has played a significant role when it comes to decreasing mortality rate, or if not morbidity. However, better understanding of the nature and their combinations and mechanisms of their actions in eliciting bioactivity, preservation of their bioactivity in storage, and how to increase their bioactivity availability is needed to achieve effective utilization for disease prevention. Okay. Also, I would like to underscore the importance of collaborative researches among experts when it comes to nutrition, food science, analytical chemistry, pharmacology, and nanotechnology, as these would be very vital when it comes to looking further and exploring further, you know, the properties, okay, and the functions and the activities of the secondary metabolites when it comes to the management of NCDs. These are just some of the literatures that are references that I have used in this presentation, and I thank you all for your attention.
Well, thank you, ma'am, for the insightful sharing. It is very interesting topic, especially for myself, that a lot of secondary metabolites that I haven't learned before may help preventing in non-communicable diseases. And I'm sorry for the presentation material. Do you mind if we share it with participants?
Yes, sure.
Okay, thank you very much.
Yes.
Now we will continue with a Q&A session. Ladies and gentlemen, if you would like to ask any question to our speaker, you may type the questions in the chat box, or you may also click on the raise hand feature if you wish to ask the question directly. And in the chat box, we already have 3 questions. The first one is from Mrs. Retno Ika. I will read it for you. According to your experiences, which one of those secondary metabolites that has a very high amount in the plant and can effectively be extracted to have its maximal benefits? Thank you. Please, maybe you can answer the question directly.
Okay, there would be no specific secondary metabolites when it comes to the maximum benefit. Okay, we have to look into first the solubility of the product or the secondary metabolites when it comes to extracting this, okay, before we look into how we could use it later or try to formulate it in prepare it in a pharmaceutical preparation. When we would go to our phytochemical analysis in the laboratory, you know, particularly in pharmacognosy and plant chemistry courses, those materials, no, that are soluble in organic solvents, they are usually the ones that we do manipulate better. We may have difficulty in actually deriving compounds coming from the volatile group, okay, volatile oils. Okay, it's difficult to distill, no, especially that they have differences when it comes to the temperature, the volatility we have to consider, and all. No, so when it comes to this matter of extracting, no, these particular secondary metabolites, first you have to look into the solvent that is right, okay, that is appropriate for you to be able to extract it from its plant material, the plant sample, and then you would already now determine whether such is can be characterized and be formulated, of course, for a possible pharmaceutical dosage form.
Well, thank you for the answer, ma'am. And I hope it already answered the question from Mrs. Retno. And then the next question is from Firdaus, Indonesia. Considering the increasing number of cigarette users in Indonesia and the trend of vape or pot being hyped so that the potential for lung cancer is soaring, does etoposide have high effectiveness in preventing or inhibiting lung cancer compared to first-line treatment for other lung cancers? Thank you. Yeah, please.
Okay. Well, etoposide is a semi-synthetic phytotaxine structural analog is used as anti-neoplastic agent. There has been well, it is true, no, that it is used as a first-line treatment when it comes to small cell lung cancer. There have been no further studies when it comes to these vape cigarettes, no, vape cigarettes yet. No? So we would be needing more researches in line with this one before we could make a conclusion when it comes to which one is better.
Okay, thank you, ma'am. And then the next question is from Yusuf Leongo. Good morning, Prof. You mentioned in your slide a lot of uses about camphor. Under what conditions camphor is often used in medicine, and what are the adverse effects of consumes too much? Yeah.
Okay, camphor is usually a very beneficial pharmaceutic ingredient, no, in external preparations. We had used it in different liniments, what you call this, these ointments, okay, and those that we would usually apply, no, in the chest, okay, for as a revivifying, okay, and also those that would now use, no, as an agent to somehow reduce cough when applied externally. It is very important to note, no, that camphor is insoluble in water. Okay, so therefore, usually when this thing is to be prepared, no, in a pharmaceutical preparation, okay, we have to consider the properties of camphor. Camphor is not to be taken in. It is usually used as a stimulant, and when we would apply it to our nerves, no, it had to be in a minimal amount. Okay, used as a counter irritant. Usually, this is just particularly for example, neuralgia, fibrosis, those associated with inflamed joints. So when it comes to its toxicity, very minimal, okay, because it is applied externally, okay, it is not supposed to be consumed, okay, orally, though there are if instances, no, that these things would happen, then we would say there are emetics that are available for the management of for intoxication. Sorry for that. I may need water.
Yeah, please. Okay, thank you for the answer. I'm sorry for the committee. I think we have one more question. So because it is very interesting, so let me read it. Question from Ibu Nurul Hakimah. What is your experience so far about the advantages and disadvantages of secondary metabolites as a drug? Seems to be more appropriate for prevention than treatment of NCDs. Is it like that? Thank you. Yeah, maybe this is the last question. Please, ma'am.
Okay. First and foremost, of course, when we have to look into the secondary metabolites, we would promote it in a preventive manner. We have not yet looked into, there are only those which may have successfully now been studied further tremendously when it comes to their activity in the treatment of non-communicable diseases. But prevention, okay, is something that is recommended. Okay, it's advocated rather, because it's these products, no, especially those that are available in our diet. Okay, these are available, and these are the food that we eat, and if we take this in moderation, and we would take this in a manner that is considered to be part of the dosage regimen, no, the approved approve a dosage of the drug or these compounds, then we are in the safe side, no. But we would say anything that is in excess, okay, then that would have to be now considered as a no-no when it comes to taking these secondary metabolites. We also have to remember that when we take the secondary metabolites, or if they are already in a certain formulation, let's say available in capsule form or syrup, and whatever pharmaceutical dosage forms they have already been prepared on, we have to look into the possible interaction with our therapeutic agents, okay, with those pharmacologic therapy that we already have. Okay, so we do not discount the fact that there could be a herbal drug and a drug interaction, no, a synthetic drug interaction and a herbal drug interaction. So if ever you plan to take in, no, a pharmaceutical, this is the secondary metabolites, or you may want to take on some herbal supplements, you need to of course be honest, okay, to your health practitioner, medical practitioner, that you're about to take this. So proper advice, okay, would be recommended.
Yes, thank you very much, Mrs. Eileen, for the answer for those questions. And I hope all the participants has already catch the answer from you. Thank you very much. And ladies and gentlemen, with this, we have ended our first session with our incredible speaker, Mrs. Eileen Molina, RPH, MPH, MSPH. Hopefully it was very insightful for each and every one of us. Thank you very much once again, Mrs. Molina, for your sharing, and I will give to Atira. Thank you.
Thank you too.
Thank you for the excellent presentation of the material. Hopefully the knowledge provided will always be useful in the future. Before that, a speaker certificate will be carried from us for Mrs. Eileen. Please.
Yeah, Atira, please, the certificate for Mrs. Eileen Molina.
Yes.
Yeah, Mrs. Eileen Molina, this is the certificate for your lecture today. I hope you may please accept this certificate. And maybe we will send you to the email. Yeah, Atira?
Yes, thank you for
Molina?
thank
This is
you.
the certificate for your
Thank you
lecture
for Ms.
today.
Eileen for the extraordinary material.
Please accept this certificate.
For the next event,
maybe we will send you to the email.
Ms. Carissa, please take over.
Well, okay, thank you, Atira. Next, we will soon inviting our second speaker, Mrs. Willy Amuaro, RN, MSN, CHA, DipHLM from Philippines, to share her lecture. Before we proceed to the second material, I would like to give a brief introduction about our speaker. Please, the committee, share the CV of Mrs. Willy Amuaro. Yeah, Mrs. Willy Amuaro received her Bachelor of Science in Nursing from St. Ferdinand College in 1998, Master of Science in Nursing, University of Lazaret in 2008, and Philippine College Hospital Administrator in 2021. Currently, Mrs. Willy Amuaro holds position as Hospital Administrator at St. Matthias Medical Center. She has experiences as a lecturer for the enhancement review of graduate students midwifery for 6 consecutive years and lecturer of course audit, Bachelor of Science in Nursing, Isabella State University, and also had some duties and responsibility as clinical instructor in 2010, and then staff nurse in 2013, and nurse administrator, also hospital administrator. Hello, Mrs. Willy Amuaro. How are you?
Assalamualaikum. Good morning.
Waalaikumsalam. Good morning, Miss. How are you today?
A little bit, the adrenaline rush. Because, I've been assigned to discuss the nutrition and I'm a registered nurse, but well, hope we will deliver it well to you.
Oh yeah, I hope so. It's okay. I think that you have master about it also, right? In nutrition. Yeah, thank you very much for
deliver it well. Yes.
Yeah.
I did some research also regarding about the nutrition, and yeah.
Thank you very much. Thank you for joining us, and it is an honor to have you here.
It's also an honor to be a speaker.
Oh,
and
thank you.
Some knowledge that I've searched also.
Yes. Well, ladies and gentlemen, without further ado, let us begin with the second topic in this webinar with present knowledge in personalized nutrition by Mrs. Willy Amuaro, RN, MSN, CHA, DipHLM. Mrs. Willy Amuaro, the floor is yours.
Okay. Let me share my screen.
Okay. Maybe the committee can help to share. Okay.
Yeah. Good morning. I'm Willy Amuaro. Today I was assigned to discuss to you about the present knowledge in personalized nutrition. So all in all, this is we're going to discuss anything about the nutrition. Okay. So next slides, please. So nutrition. What is nutrition? We'll just give some brief review about the nutrition. Okay. So what is nutrition? It's the study of the nutrients, of course, in the food, how the body uses the nutrients, and the relationship between the diet, the health, and the disease. It is also a vital component to overall wellness and health. So nutrition refers to everything that is consumed and processed by the human body, which is nourishes and provides essential building blocks for growth, for repair, energy, and all other necessary body functions. So nutrition comes in forms of food, beverages, vitamins, and even exposure to sunlight, which is a vitamin D. So our body needs those nutrients. So with the nutrients, we have the macronutrients and micronutrients. Okay. So for the nutrition, there's also we have the food, we have the nutrients, and the digestion. So food is the one that is a substance that we ingest or eaten that nourishes our body. So with the nutrients that came from the food is the chemical component needed by the body to provide energy and to build repair tissues and to regulate life process. So we have the digestion, which that include in the digestive system, of course, with the breakdown of the large insoluble molecules into lower water-soluble food molecules that they can be absorbed. I'm so sorry for that. Into the watery blood plasma. So we have two digestions. We have mechanical digestions and mechanical and chemical digestions. Next slide, please. So let's have a quick review of your digestive system.
Halo Bunda Korla.
Okay, so let's have a review of your digestive system to understand what will happen into your gut. How does the nutrients absorb? How does the food digested? So we have a quick review of the digestive system. Let us start with your mouth for the ingestion of food, passing through your esophagus, and then down to your stomach. And then there's a small intestine, which the intestine is a part where is the main function, the digest of foods and absorb nutrients needed by our body. So we have the large intestine as well, which absorbs water and changes the waste from liquid to stool. So digestive system, the main function of this is provide mechanical processing, digestion, absorption of food, secretion of water, secretion of enzymes, and so on and so forth. So we have here the macronutrients. What are the macronutrients? So we have carbohydrates, which is energy-giving food together with the protein and fats. These carbohydrates are the building block of our body. Carbohydrates are made of tiny chains of sugars, which carbohydrates are made of 45 to 65 of healthy diet. Some carbohydrates are also worse than the others. So from the carbohydrates, we have the simple carbohydrates and we have the complex carbohydrates. So we have also here the protein. The protein works to repair muscles, grow muscles, regenerate some regenerative tissues. So if you have an operation, protein is a good source for the repair of the wound, together with the vitamin C. So we have also fats here. Your fats is considered sometimes scary to other people because we all know that fats can be lead to obesity sometimes, and for the cholesterol or the fat depositions in our body. So we have for the fats, there's a bad cholesterol and we have the good cholesterol. So we have for the the alpha-linoleic acid is a good sample of fats also, which is good for the brain and for the heart. Okay, next slide. So this is a picture of a balanced diet plate. But the question here is it applicable to all? So there are some persons that are having this lactose intolerance or gluten intolerance. So they have to avoid the wheat, they have to avoid the milk. so on and so forth. And then we have here, next slide. So we have here, as you can see, we have hypertension, obesity, diabetes, and cancer. This is due to what is happening nowadays. We are fond of eating foods that is high in sugar, in fats, and we are not we're not cooking our food anymore. We're just a fond of buying fast food, just like McDo. We have the Jollibee. So it can lead with these diseases, the hypertension, the obesity, and diabetes, together with the cancer. So these are the associated with the unhealthy habits of nutritional excess, stress, and also inability of activities. We're not doing the exercises anymore. So next slide. So in Indonesia, as you can see, the number of the overweight of adults has doubled over the past 2 decades. This is based on WHO and UNICEF. As you can see, the Indonesia is ranked number 5 in Asia. For number 1 is we have the Malaysia, and then we have here the let me check on that. So number 5 is for the Thailand. And then we're in for the Ministry of Health. Cancer is also the 3rd leading causes of death in Indonesia. It also ranked 8 in Southeast Asia and 23rd in Asia. So in relation to the obesity, diabetes mellitus, cancer, and hypertensive, it also increases in Indonesia. So why? This is due to the poor consumption of unhealthy food, shifting from the traditional diets toward processed products that are higher in fat and sugar, because this is less expensive than the wholesome foods that we are cooking at home. So dairy recommendations should also be tailored to life stage health and objectives. This is it's like a growing child needs a different nutrients need than a pregnant woman. Just like in a pregnant woman, what does a pregnant woman need? We need the folic acid. The folic acid need for the development of brain, prevention of neural tube defect. The neural tube defect is a kind of, if you know, some babies are born with without brain, and then the pregnant woman also need a lutein, which is good for the eye health. It improves also cognitive development. So these are the nutrients needed to prevent complications. And just to share with you, for the development of the baby, the first is the brain. So the folic acid should be taken prior to pregnancy. So healthcare specialists like nutritionists and dietitians, so they have the general guidelines for dieting. However, our bodies differ. We have individual uniqueness. So based on individual genetics, one can be fast or slow metabolizer. This is the change of recommended dietary suggestion. So one sample of this is, if you are fond of coffee, some are slow coffee metabolizer, which can increase the heart attacks and high blood pressure, or GERD, which is the upset of the stomach, gastroesophageal reflux disease, which is, this one leads to the prolonged accumulation of coffee, because the coffee contains plant chemicals that are good for the others, while the other will not benefit. Some drink coffee just to be waking them up, just to be alert, because we all believe that coffee also is a stimulant. Others also, if they drink coffee, they will fall asleep immediately. So it's individual differences. So personalized nutrition. Personalized nutrition is an approach that provides targeted nutritional that is advised to an individual based on the information specific to that person. So as you can see, it's a question, what should I eat? Nowadays, in the new generation, there are so many called personalized. We have personalized phone, personalized dress, personalized bag, personalized mug, t-shirt, notebooks, bags, or we call it also customized. So we choose that is according to our needs because we believe that every human is unique. Even twins have different responses when you're going to serve them with the same meal because they have different gut microbiome. They will give you different interactions. Okay, so with the personalized nutrition, it was designed to know what nutrition or diet that suits best for individual depending on needs and disease. So as I mentioned a while ago, depends if you have a cancer, your diabetes mellitus, you have also the thyroid problems, you have a gastric ulcer, you have your hypertensive. So what is the objective of this personalized nutrition? It is to improve the dietary habits for the prevention or the treatment of chronic disease. Just take note on this. It's like choosing your husband or your wife. If you're going to choose your husband to be, or your the one we call it the one you want to love, you want to stay for the longest of your time, you're going to ask yourself, does this person is best for me? Will this person will make it worse of having him or her in my life? Will going to be an happily ever after, or will I suffer for the rest of my life? Does this person will bring the best out of me, or will it make me worse? Okay, so in personalized nutrition will help you to choose the right and appropriate diet and nutrients that need our body. Nowadays, as I'm doing my research, there are some countries, companies, especially in American, Western countries, they're doing now the personalized nutrition. There's a research, there's a study. So with this, while doing the personalized nutrition research, some countries are companies that asking you to send your poop. They will study your poop. What would be the appropriate food for you? They will extract some blood. If there's an increase of the cholesterol or the triglycerides. So this personalized nutrition was way back, I believe, 10 decades, been studying for the personalized nutrition to develop what would be the appropriate nutrition for each and everyone. So why do we need a personalized nutrition? The main objective, as I mentioned a while ago, of the nutrition is to sustain and improve individuals' health by using genetic, dietary, and scientific information. So all of this information is used to provide us healthy eating advice and implement necessary nutritional changes. Our genes influence absorption and transportation, metabolization of nutrients that we consume. So we live in an era of customization. This trend is very widespread in the food industry. It means that everyone needs an increasingly personalized diet that fits in people's personal health goals. So everyone is unique, but learning from other is a real thing. Copying others is not. Take note of that. Learning from others is a real thing. Copying others is not. So what does it mean? You don't have to copy what is the nutrition or what is the diet of this person, because you want also to be fit. You want to be fit. You want to maintain those healthy, those muscles, which is not also applied to you. So you have to so in personalized nutrition, you have to adapt what is the appropriate diet for you. Because why? We have individual uniqueness. Our body was designed differently. So what are the benefits of personalized nutrition? Personalized nutrition can help a person achieve a long-lasting dietary changes for long-term health benefits. So proper nutrition, including dieting right, preventive step that inhibits the worsening of conditions. It benefits the brain, the body, and life, of course. For the brain, of course, we know it increases your cognitive function. It reduces brain fog. It's focus. It boosts focus. It makes it easier to concentrate on the day-to-day tasks. So what are those foods that helps you focus while reading, while reviewing? Some says you have to eat food for the brain. Those are nuts. Example are peanuts, cashew nuts, almond nuts, and then you have also to drink coffee, but in moderation. And some says for the absorption, it helps a lot, the dark chocolate. Okay. So also it helps for the body. When you eat for your genes, you're referring your body, your gut that needs the day-to-day activities. It helps also your gut to metabolize or synthesize properly those nutrients that you ingest. It also prevents the chronic diseases like cancer, as I mentioned a while ago, and heart diseases. For life, the benefit to life, of course, healthy life, healthy living, healthy food, it makes you happy. So if you want to get sick all the time, you eat those unhealthy foods. Who will suffer? Of course, us. We will suffer for the inappropriate diet that we ingested. So what are the advantages of the personalized nutrition? Of course, nutritional habits are maintained over time, as I mentioned. So we work on the particular and do not adjust plan that do not correspond. The plan is designed according to the taste of the person, of course. It's a food choice. Has preference, it's considered, making it, it's a bearable for the patient. You will not suffer. It will not be a burden for you to prepare those foods that will not needed by your body. It's not restrictive also. It's an enjoyable and can be achievable in a way that you will enjoy this because you love it. You want to be healthy. You want to maintain those figures. You want also to avoid hospitalizations. So when creating a nutritional plan, there are some few important considerations to keep in mind. What are those? Management of health conditions. So you have to consider this in personalized nutrition. Does this diet appropriate for me while I have the diabetes mellitus? I have cardiovascular disease. I have liver disease. I have cancer. So you have to consider those things also. What I mentioned a while ago, the diet for this person is not applicable also to you. So you have to choose what is appropriate according also to your needs. Food intolerances and allergies. You have to consider this. You want that diet. If you're going to advise a diet for this particular client or patient, but the thing is, this patient is allergic to this, just like seafoods, where the patient is having also lactose intolerance. So you're going to advise also that the patient should take a milk that is lactose free. Nowadays, I believe there's a milk that is designed for a lactose intolerance clients. So you have also to consider the lifestyle of this patient. Lifestyle. Does the patient is working from 8 to 5? And then you want him or her to prepare the food, bulky of food. And how could that client prepare if also traveling from home to her workplace? And what if the travel time is 2 hours? So it will be also added burden to that client lifestyle. What if also, sorry to say, you can't afford those diet, those food that was recommended to you. So it will be an added burden on your part. Also the food preferences. Food preferences. What if you don't like this food? And this is the food that you should eat. So there will be a problem. So in giving a nutritional advice, you have to check also the food preferences, and you must also have or must, and what you call this, you must consider what are the other options to give to that client. In relation to our personalized nutrition, if you hear this, there is the so-called gut microbiome. As you can see in the screen, we have the healthy microbiome and we have the unhealthy microbiome. This gut microbiome, anything inside from your mouth down to your cecum, inside your gastrointestinal tract, anything that packet, there's a gut microbiome. So why does personalized nutrition is important to our gut health? Because everyone holds a unique intestinal flora, also known as gut microbiome. So our body, especially our stomach, is full of trillions of bacteria, viruses, and fungi and other microbes. So these are collectively called microbiome. But take note on this. Some bacteria are associated with disease, but this gut microbiome are important to our immune system, to our heart, into our entire health. So this gut microbiome plays a very important role in our health because it helps control digestion. So it benefits our immune system and many more. So if you have an imbalance, unhealthy and healthy microbes, it will really affect your personal being. Okay? So why is it important to have a healthy gut? Of course, this is what we want for long-term health. We want to be healthy all the time, isn't it? You don't want to get sick. The more energetic you are, because you're eating the right nutrients that is good for your gut. So you have the less sickness, less hospitalization, of course, mental alertness, and better emotional being. Now, if you don't eat proper, maybe some are sleepy na because there's a lack of nutrients that is functioning inside our body. So eating poorly can do two things. It can prevent us from being healthy and can damage our gut microbiome that causing the proper breakdown of nutrients needed by our body. In relation to our gut microbiome, base, next slide, please. So base, okay. How to improve your gut microbiome? I believe the slides is, okay, just we'll just continue. So how to improve your gut microbiome? By changing our diet, of course. In changing our diet, you have to eat vegetables. We have to cut out sugar and avoid those processed food. What are those processed food? If you are here in the Philippines, we call it casino. If you are known with the longanisa and some other tapa, I'm so sorry. And I believe you have also McDo in Indonesia, in Indonesia, Jollibee. So I do consider them as fast food and processed food because they are packed and will stay for a long, long time. So it's a no for that food, okay? So this one is to stock up the dietary sources of prebiotics. We all know that these probiotics are very essential in our body. We will discuss that later. And then you have to avoid antibiotics. Why? We all know that antibiotic is very helpful, especially if you got sick. But the thing is, this antibiotic also will destroy your gut, especially for 5 times in a year you get sick of the same disease. Your immune system, your gut, your body will be immune to that antibiotic, and it will increase again the need of the antibiotic. So what will happen to your body? Those normal flora will be destroyed, and you will be resistant to those kind of antibiotics. Okay, so as much as possible, we have to eat properly to avoid taking antibiotics. And also, do not take antibiotics without the prescription of the doctor. So avoid also eating junk foods such as chips. These chips are unhealthy. Pizza, what else? Sorry, for the fast food. And then exercise, move your body at least 30 minutes. 30 minutes a day. It will awaken up your body and avoid stress. Due to the pandemic, 2 years, I believe almost all of us got into stress. What happened when we are stressed? Isn't it that even our gut microbiome, I mean, even their stomach, even their concentration was affected because of the stress? You cannot concentrate, especially just like this. It's a kind of, there's when you're about to discuss something that you cannot with your client and others, that you want to solve something but you cannot do it, it makes you stress. Those cells inside your body will be confused what to do, so it will lead to stress, and the stress will lead to cancer. Okay, one factor that causing cancer is stress. So be careful. And when you're about to feel that you're about to stress, just sing and pray. Prayer is one effective way to relieve those stress. Okay, so I have also read one study that lemons also are high in pectin, a kind of fiber that acts as food to our gut bugs. So this one is promoting healthy gut bacteria for balance and growth. So the fiber of the lemons stimulate the growth of beneficial probiotics into the microbiome like bifidobacterium. Okay, next slide, please. I believe the slide that I gave is was not but I'm so sorry. Okay, it's okay. I'll just continue because the slide that I gave was not there because I changed the slide. Okay, we have here the keto diet. Yes. I presented the 3 diets, which is the keto diet, Mediterranean diet, and the diet for the cancer. Why did I post this one? Because just to be aware of those diet that are we heard nowadays, and also for the cancer, just to be aware what are the foods to be avoided. Okay. For the keto diet, it's also known as the low carb, high fat diet. Okay. Let me check on that. Okay. So keto diet is people on keto diet are very small amount of carbohydrates, protein, and high fat per day. They will, for it's like a plate. This is a small amount of carbohydrates, but there's a plenty of protein and fats. They believe because keto diet is good because they believe that they will not get a disease just like diabetes. So according to research, just want to share that keto diet is conventional medicine used mainly to treat the hard control called epilepsy in children. That's why it was developed because it helps a lot for the epilepsy. So normally, the carbohydrates in foods are converted into glucose, wherein these glucose are transported around the body for the fueling of the brain function. So what will happen here if there is a small amount of carbohydrates that remains in our body, the fats that you ate, plenty of fats, will be converted into ketone bodies. Okay? So these ketone bodies will eventually lower the frequency or the onset of the epileptic seizure. But take note on this, the ketosis or the ketones is not good also in your body. You might be developed into coma, just like the diabetic ketoacidosis or DKA. And it will also makes you fall asleep. So it also, as you can see, we have the pros and cons of the ketogenic diet. It's burning fats. It also aids of the secretion of ketones, protein sparing effect, low insulin level, decreased appetite. So low insulin level because this is known as low carbohydrates. We all know that carbohydrates is the glucose or a sugar that needed by our body. But in exchange to carbohydrates, they are consuming more fats because they believe, which is also, yes, it is the process of the body, the fats will be converted into glucose. It will be converted into energy that the body needs it. Okay? So cons or the
I'm sorry,
triggers.
ma'am. It is 5 more minutes left for presentation. Sorry.
I'm so sorry. Okay, can you just give me the tryptophan, tyrosine, and indolic the slide for this?
Okay, please,
Tryptophan,
committee,
tyrosine.
for the next slide.
Because I want to emphasize those things.
Tryptophan.
Yeah. I believe the last PPT I gave that was not that. Yes, tryptophan, I believe. No.
Yeah, please, committee, maybe can
Okay,
you
I'll
please
just
jump
to the tryptophan.
To the tryptophan.
Yes. So these are the foods that need by our body, especially the gut microbiome. And we'll back to the gut microbiome, the tryptophan and tyrosine is an amino acid. Those are the proteins. This is also known as this tryptophan produce serotonin, which synthesize melatonin. So serotonin is a happy molecules. Melatonin in the body makes you sleep. So even you are given with the diamonds, roses, if lack of tryptophan, it will not make you happy. You're always grumpy. So melatonin, if you're lack of melatonin, you are unable to sleep. Then we have the tyrosine. It improves your attention, improve alertness. So what are these? Tyrosine, we have dopamine, adrenaline rush, thyroid hormones, and melanin. So with the dopamine, it calls chemical messenger together with adrenaline and noradrenaline. It's like there's a fire, you can carry a 7 cubic of refrigerator, and then if the fire is gone, ceasefire, you cannot carry. That is because of the adrenaline rush. Okay, the melanin is the color pigmentation of our skin. So the more darker you are, the more melanin you have. Then we have the indole trilactic acid. As you can see, we have the kimchi there. The indole trilactic acid is a fermented food, just like yogurt. We have also the pickles. So fermented food is very, very healthy, very, very what we call this, good food for our gut, because it helps to unlock those nutrients into our body that allows to absorb more nutrients. And it's also managed for the constipation and diarrhea. Okay, so for the last slide. So just take note of this, that behavior change is the key. It's like when it comes to our diet, we have to be cautious in choosing what kind of nutrients we need our body. We just remember, everything is free, but not all are beneficial. It's one diet doesn't fit all. It's you are what you eat. So if you feel like you are sick, lack of energy, yawning, get up of that couch, get out of the door, and have a checkup.
I'm sorry, Mrs. You can unmute.
I'm so sorry. I thought that the 24th slide is a less than 30 minutes.
Yes, please continue until your last slide, please.
It's there. Yes. I just want to share this, the cancer, because we all know that cancer is also, so we have to be picky on the foods. Okay, well, just so one diet. For the last thing, one diet doesn't fit all. As I mentioned a while ago, individual uniqueness. You are what you eat. So if you feel like you are sick, lack of energy, get up of the couch, get out and have a checkup. Listen to your gut. Thank you.
Thank you very much, Mrs. Amuaro. I'm sorry, I have misspelled your name before.
It's okay.
Mrs. Amuaro.
No. Yeah, it's okay. No big deal.
Yeah, thank you very much for the insightful sharing. It is very interesting. Yeah, fun. Especially when choosing personalized nutrition is analogous to choose a husband or wife to our entire life. Yeah, so it's very interesting. And unfortunately, because of limited time, there are some materials maybe hasn't been explained. And for the presentation material, do you mind if we share it with participants? Maybe to catch up some materials that we can explain for you. Yeah. Is it okay for you?
Yeah.
If the materials will be sent to our participants this morning.
Materials? I
Yeah.
don't have. Yeah, I don't. I
Yeah.
didn't prepare for any materials.
Oh, I mean your presentation. Is it? Do you
Yes,
mind if we share it to participants?
yes, 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 yes.
Yeah,
No
okay,
worries.
thank you very
Yes.
much. Yeah, and we will now continue with the Q&A session, ladies and gentlemen. If you would like to ask any question to our speaker, you may type the questions in the chat box, or you may also click on the raise hand feature if you wish to ask the question directly. And let me
Maybe they
see.
will thinking now. They are thinking now if they how they choose their husband and wife.
Yes. They must choose carefully for the diet because it will affect your entire life, maybe. Yeah. Okay. We already have one or two questions. The first one from Anggita Devi from Tegal. Yeah, it's quite far from Malang. Is it possible to grow taller at 20 years old? If so, what nutrients are needed to support it? Oh, is this the question is also for my questions because my height is not too tall, so it represents my question also. Is it possible to
Uh-huh.
grow taller at 20 years old? Yeah, thank you.
Oh, I believe even based on the scientists and even those medications, food supplement, I believe you will not grow tall at the age of 20 years old. Maybe I can blame your mother because lack of those calciums. We all know calciums is a very important. The vitamin D is very important. Those supplements are given also to the pregnant woman because as a result, if you are a kind of hard-headed pregnant woman, you're not taking those food supplement that is intended for your baby, it will lead for stunted growth. It means small. The small, the height maybe is for 11 or 5. But here in Asia, we just, our height is minimal. We don't aim for those height of those Western countries because that is based on their genes. Our genes in Asia is until 5'5", I believe. And
Okay.
those, I believe also the nutrients that needed to support it is we have also the, yes, I mentioned calcium, vitamin D, that those are the nutrients needed by the body. Milk also, drinking milk. We have to drink milk because there's a research, they are taking medications, but I don't remember that medication. They give at least 5, from 5'8", 5'5", that person became 5'8", but at the age of 18, like that, because we have also the, when you reach 20, 21 years old, your growth spurt will stop.
Yes, thank you, Mrs. Amuaro. Maybe what we can do is to choose husband that is far taller
Taller than you.
yeah, to
Yes, it is.
create a
It will
better
affect also our
generation.
genes. Yes.
Yeah. Okay. Yeah. Thank you. And then for the second questions from Mrs. Nurul Hakimah. Mrs. Nurul Hakimah is a lecturer in the nutrition department.
Assalamualaikum.
Yeah. How to prepare a personalized diet in a food service context with a mass consumer. So how if we implement this personalized diet to maybe mass consumers, a lot of consumers, yeah, in a food service context.
Yes, I've never been exposed to those, food preparation for mass consumers. I mean, plenty of people, but I believe you have to check also plate by plate. They have to weigh. I believe they're doing that. There's a weighing system for this preparing those personalized diet, and they will ask, just like for the nutritionist and dietitian, I believe they are giving the certain calories, if I'm not mistaken. They're giving the certain calories, how many percent for the carbohydrates, how many percent for these fats and for this protein and other nutrients. I hope I answered your question for this. Thank you.
Yeah, thank you, Mrs. Amori. We have the next question from Mr. Johannes. Mr. Johannes, the question is, do you think that eating raw food, mainly vegetables, really helps to stay your stomach healthier? Thank you. It is also from a lecturer of Department of Nutrition.
That is case to case and basis based on my observation. Not all raw foods should be eaten raw, isn't it? There are some foods that should be cooked, and those vegetables should be cooked properly, no overcooked, because those nutrients from that vegetables will be it will be destroyed. I believe carrots is one. Yes, it is. Is it a vegetable or food? And then we have also those some are eating raw foods is cabbage. It will affect your stomach really if you eat a raw food that is not appropriate to eat. That is my answer. Okay.
Yeah.
Because it's a case to case basis.
Okay.
It's like
Thank
if you want to eat this kind of food, is it appropriate? Is it right for the gut? It will affect you. It leads to diarrhea, stomach ache, and so on and so forth.
Yeah, so it is case by case. Maybe I hope it's all answer your question, Mr. Johannes. And then we move on to the next question. I'm sorry, maybe because we have some time left. So I read the next question from Gabriela Adifa, Indonesia. On one of the slides that you presented, there is sentences avoid antibiotics. So what should be done if our bodies have been resistant to antibiotics? Are there medications that can cure antibiotic resistance? Thank you.
Yes, I mentioned a while ago that antibiotic resistance, because in a hospital setting, we are doing the blood culture. So they will test your blood. Those antibiotics will be listed, and some are sensitive, just like I mentioned, cefuroxime. We have the cefixime. You have the, what do you call this, amoxicillin. It may be that you are resistant to that. But if you, again, suffered from that disease, there is another appropriate antibiotic for you to be used. Okay? So it means that you are resistant. Your body will not listen to anymore that certain antibiotic. So you will need another antibiotic. It may be higher or it may be lower, that will cure your disease.
Okay, thank you. And the last question maybe from Salvania Isnata Zahro, Indonesia. One way to improve the gut microbiome is through exercise. What types of exercise are effective for improving the gut microbiome? And if we change our diet but don't exercise, will our gut microbiome still improve? Yeah.
Yes, of course. The exercise, of course, we have the, you have to exercise. Well, the exercise is just like you have to touch. This one will help you to eliminate if you have the constipation. Okay, so that is considered exercise. It's just a stimulation. It helps you if you have problem with constipation. It helps you a lot in defecating. Now, if you are, of course, nowadays, we are focused on the cell phones, internet connections, couch potato. We are focused, we are not doing the exercise. We can still improve our gut diet through proper nutrients, proper ingestion of food, that the food that is have a good nutrients, just like I mentioned a while ago. So you have to take care of your gut microbiome.
Okay, thank you very much, Mrs. Willy Amuaro, for answering these questions. And ladies and gentlemen, with this, we have ended our second session with our incredible speaker, Mrs. Willy Amuaro, RN, MSN, CHA,
It's okay.
DipHLM. I'm sorry.
Even me, I don't use with a we because I just get married.
Oh,
I choose the right
okay.
husband.
It's a really new knowledge for me because I haven't have a friend from Philippines, so it's new things for me. Thank you, and hopefully it was very insightful for each and every one of us. Thank you very much once again to Mrs. Willy Amuaro for the incredible sharing. Hopefully the participants are able to gain new knowledge from this session. So see you all later, and thank you very much. Over to you, Atira, to give the certificate for the speaker. Wassalamualaikum warahmatullahi wabarakatuh.
Masalam.
For Mrs. Eileen and Mrs. Carissa, the certificate will be given to Mrs. Alakwidayanti.
Okay. Thank you, Atira.
Assalamualaikum, Ella.
Waalaikumsalam, Mrs. Willy. Yeah, I give you the symbolic certificate. Thank you, Mrs. Willy, for
Thank you
sharing
very
your
much. It's an honor.
information this morning. Hopefully, we can continue in the future, yeah, Mrs.
Masalam, syukran katir.
Thank you, thank you.
Masalam.
Thank you for Mrs. Alakwidayanti and Mrs. Willy Amuaro. Thank you to Mrs. Eileen and Mrs. Willy for the excellent presentation for the material. Hopefully, the knowledge given will always be useful in the future. Thanks also to Mrs. Carissa, who has guided the course of the first session today. Then enter the second session, the presentation of the material by the research person who was no less extraordinary. Here, I am also not alone. I am assisted by Mrs. Hanandayu Widwiastuti, SSE, MSE, as the moderator who will accompany the session this time. Well, before that, I will greet him first. Good morning, Mrs. Hanan. How are you today?
Okay, I'm good.
Yeah, Alhamdulillah. Before that, I would like to read CV Mrs. Hanan. Please, Komite.
Atira, we cannot hear your voice.
Okay. Mrs. Hanandayu, SSE, MSE, born in Probolinggo, 7 September, and education is Bachelor of Chemistry in Universities of Brawijaya and Magister of Chemistry in Universities of Brawijaya, and what field of interest is analytical chemistry, and work experience is associate degree lecturer of pharmaceutical and food analyst Polytechnic Kemenkes Malang 2017 and presently, and bachelor degree lecturer of mechanical engineering University of Pancamarga Probolinggo 2013 until 2016, and research field is food and beverage analyst and filtration technology. Okay, for the next event, I will leave it to Mrs. Hanandayu Widwiastuti as the moderator. To Mrs. Hanandayu, please take over.
Okay, thank you so much, Atira, and Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Good afternoon, I guess. It's already 11:21, okay? Good afternoon for all the ladies and gentlemen, or for the attendance today. And let me say hello first to the Honorable of the Head of Nutrition Department, Mr. Tapriyadi, and for all of the Head of Study Programs at our department, for Mrs. Widayanti, Mrs. Puchirahayu, and Mrs. Sutomo Kaswari, and the last one is for Mrs. Hakimah. Okay, and of course, for all the honorable speakers for today, maybe the speakers are still already here, for Mrs. Molina and Mrs. Amuaro, and of course, for our third speaker, Dr. Nurhuda Manshoor. Good afternoon. And first, as the MC said, I'm Hanada Yudiastuti, and I will be the moderator for this third speaker for this webinar. And the topic for this session is about traditional medicines for sustainability of drug supplies. And for this third session, we still have the same terms of the webinar to carry it out, which is for the speaker, still have 60 minutes each, which 45 minutes for material delivery and 50 minutes for the discussion session. And during the speaker's presentation, please, for all the participants to turn off the audio, but you may please keep the video on or the camera on, okay? And if all of the audience maybe have any question and want to ask the speaker for this session, please leave the comment or leave the question by Zoom chat room by writing your name or institution name, and then followed by the question. Or maybe if you want to ask directly to the speaker, you may click or you may press the raise hand button in the feature in the Zoom, and then you can deliver the question to the speaker. But for the question, for the direct questions, maybe you can ask after the delivery of material is complete, okay? So here is our speaker for today, ladies and gentlemen, Dr. Nurhuda Manshoor. Hello, Dr. Manshoor.
Hi, how are you?
Okay, I'm good. How about you, doctor?
Okay, I'm fine. Thank you.
Yes, okay. So before we start the presentation, but please allow me to give a brief introduction about our speaker today, which is Dr. Nurhuda Manshoor is an associate professor at Faculty of Pharmacy at UITM. And okay, thank you. And currently works at Ataur-Rahman Institute for Natural Product Discovery at University Technology of Mara. She holds a master in phytochemistry and PhD in natural product chemistry. Okay, and Dr. Manshoor research interest is in phytochemistry, of course, and the replication of natural products and metabolomic fingerprinting. And her current project is about, what is this? Appraisal of the relationship between bioactivities of miabenol C with their isomeric properties. Okay, and Dr. Manshoor also received some awards and recognition. Okay, please turn off the okay, thank you. Okay, let me repeat once more. Dr. Manshoor also received some awards and recognition. Some of them were the Excellent Service Award at UITM, and she got it on to 2016. And there's another award, which was Masuma International Research Fellowship Award, is also on 2016. Also Group Polytechnic Senior Grant Awards in 2014. Recipient of MOE Postdoctoral Scholarship at 2014, and also UITM Young Lecturer SIM Scholarship at 2005 to 2009. Okay, once again, Dr. Manshoor, it's an honor to have you here. And here we can start the third topic today is about traditional medicine for sustainability of drug supplies. So Dr. Manshoor, time is yours.
Thank you. Thank you very much.
Okay.
Okay, I'm waiting for the slides to come in.
Yes.
Okay. All right. Okay. Thank you very much for the very kind introduction, and thank you for Polytechnic Kesihatan Malang for this opportunity to talk to you. Okay. So actually, when I got this, I got the subtopic of traditional medicine. I did not know that you have a main theme of non-communicable disease. So now we have what we have. So talking about traditional medicine and medicinal plant, actually we in Malaysia, we fully aware that Indonesia is far advanced than us. So I'm not here talking about developing traditional medicine in Malaysia. Okay, but this is an overview. I hope it would be useful for the students and also for the young scientists about the overview of traditional medicine in the world, of the development of the traditional medicine until now. We have a finished product of herbal, finished herbal products and supplement material. Okay, so next slides, please. Okay, so let's look have a blink on the traditional medicine around the world. When we are talking about traditional medicine or traditional medicine or herbal medicine, it's not necessarily used by the underdeveloped countries or developing countries or poor countries. No, it's everywhere in the world, and it just in different pharmaceutical dose, different form. So the first picture is from Madagascar. There are some guys selling wood chop, some on a street. And then the middle pictures, two pictures in the middle are from South Africa. There are some shops selling raw wood, and then another shop selling properly preserved and properly shelved traditional medicinal plants. I mean, and then the one in the right, on your right, top right, this is from a picture from a traditional Chinese medicine shop, and the one below is a modern herbal shop. So it can be in any form, in anywhere. Next, please. Okay, and then I have some pictures of some ladies carrying jamu. Then it's not necessarily sell in raw materials. They might also prepare the medicine, and then is customized for you when you go there. And you know this jamu kocok from Indonesia. You go there and tell your illness and your conditions, so they will prepare specifically with some a specific ingredient and composition for you. So this is also another advancement of medicinal plant used in traditional medicine. Next, please. Next, please. Okay. So why, after so many years, so many advancement in modern medicine, there are still traditional medicine around? People are still using them. Okay. First, they are cost effective. You can get at very low price, and there are some people who can afford to get modern medicine and can't afford to even reach the hospital or the clinic. So you can get this around your settlement. And second one is easily accessible. It can be anywhere. You can, if you are staying in a countryside, you can go to the wood and pick some plant or some herb, or there are some also weeds that use as medicinal plant, and they're also the variety is very wide. You can get many species, okay, depending on your locality, and you can also prepare the medicine from many different organs of the plant, from the flowers, the leaves, the barks, the roots, any organs of the plant, and even the seed. So the variety is very, very vast. So it's much easier to get. And the preparation is also simple. You can see in the picture that sometimes you just grind, and then or pound, make a paste, and apply on your skin for your skin condition. And sometimes it just the one of the picture in a cup is a decoction, the concoction of some Chinese herbs. So it just infused in water, and then you drink the water, and then the one with the pot is the decoction. You boil until some consistency, then you just use it. Then it also can be prepared in pharmaceutical dosage form. For example, you have the extract. Usually it's not extract. Usually the powder in powder form. You put it in capsule, and then for easy handling and also easy administration, you don't need to handle the bitter taste of the medicine. Okay, and then it's considerably less side effect. This is part of a belief that it has less side effect because it's natural, which is not necessarily true, not always true. But then, considering that the active material is very small in the plant, in a raw plant, or even in the extract, so the side effect is, if any, would be lower than the single entity drug. Okay, and then the strong credibility, it was used for hundreds or thousands years ago by our ancestors, and then they are all safe, they are all healthy, so it has a credibility. Whether or not it's true is another story. Okay, so this what made traditional medicine still now in modern era being used. Okay, next slide, please. Okay, so let's go just a little bit on this history of a medicinal plant. People use a plant for medicine since history knows. Okay, we do not know when, but we know know that we always depending on a medicinal plant for any condition, health condition. Okay, so the most last time concern was foodborne pathogens, or any to avoid food poisoning. So they use spices, and perhaps the spices actually come from because the use of spices today historically, because they are antimicrobial. They are antimicrobial and have antimicrobial properties, and then even the wheat, and then any plant that they used last time, they believe that they might cure the disease. Okay. Next please. Okay. In ancient time, if we are talking about archaeological evidence, is only the evidence that we can find through manuscript or through tools, medicinal preparation tools. But then it was believed that long before the archaeological evidence, people already use plant as medicine. Okay, so the first written manuscript known was the Sumerian, who create the clay tablet with list of medicinal plants, okay, such as myrrh and opium. Myrrh is plant exudate, the resin from plant. You cut the plant, and then the resin come out, so you dry the resin, so you get the myrrh. And also opium. Opium is one of the oldest drug in the world. Next, please. All right, so some example, the Herbal papyrus. This is written in Egypt while the Egypt civilization that time, and it has a prescription of a long list of medicinal plant. Okay, one of the not the most famous at that time, but it's still used until today. Today, that the cannabis that they apply for inflammation, and there also not only list of medicinal plant, there are also some recipe for medicinal traditional medicine preparation. Okay, so for this is one example. I bring it for you. They use mixture of herb, put it on a brick, and then they heat up the brick, so the fume from the herb they inhale for some condition. Okay, and then Ayurvedic medicine, this we know and still practice today, heavily practiced today, and they use a lot of turmerics. Most of the preparation use turmeric. Okay, so there are manuscript, the Rig Veda, written on this Ayurvedic system, and now they have many branches of Ayurvedic, and then Ayurvedic health system, and now they have this Charaka and Shushruta branch of. They are also Ayurvedic medicine. They come with different names, but they are part of the Ayurvedic system. Okay, next please. All right, so in China, the Han Dynasty emperor written list of Chinese herbs. Okay, and then one of the most maybe widely used until today is this ephedra. In Chinese they call it ma huang, and now in modern drug we isolate ephedrine from this plant. And of course, long before this emperor wrote the manuscript, they already practiced the medicinal plant. And then this Dioscorides, this is the first Materia Medica written in Arabic region, including the Iberia Peninsula, the Andalusia at that time, until the Persian region as well. So in this Materia Medica is not only list the medicinal plant, is also explain the authentication of the plant, how to identify the plant, so you not misuse the different plant for your medicine. Okay, and then this Galen, this is actually also in ancient time, but then people say that he was actually a physician, but he is a father of pharmacist. If according to what we practice now, he study, and then he document the use of some the medicine, and then the effect, and revise of the usage of the medicine. Okay, next. All right, so we are talking about medicinal plant today. I think this is no strange to Indonesian. I just bring a few examples. The plant that is used today, and then but we do not know whether or not they are fully healing whatever condition. Okay, so now we have aloe vera, and then this it contains mucilage. Mucilage is actually contained in many kind of plant species. Mucilage is carbohydrate that hold water, so it can hold the way the glucose connect with each other to form the glucose polymer, which is carbohydrate, make the mucilage hold water. A lot of water is swell. When you introduce water into mucilage, it will swell, and then it hold water, so it has this cooling and moisturizing effect. And then the chemical compound, we found aloin and aloimodine. These are analgesic and purgative, but then we don't use aloin for analgesic in modern drugs yet. We have better analgesic in the market now, but then aloimodine is used for a purgative treatment. Okay, and then Centella acetica, this is pegaga. They are aceticoside, acetic acid, and previously people believed that it can be used for cholera, ulcer, bronchitis, leukorrhea, and leprosy, but then there is no evidence that this works. Okay, but then aceticoside and acetic acid was isolated from this plant, but then it's not proven that these compounds actually work for the treatment. Okay, next. All right, this is licorice. It contains coumarin, so traditionally it was used for stomach-associated condition, and now people in Europe use licorice in their sweets. I think permen in Indonesia they call it. So they use for this condition, and it's not scientifically proven that it works that way, but then they use, and then they find it it's suitable for them. And then Azadirachta indica, this is the leaf, this is the plant that in Indian region from Sri Lanka, India, Pakistan, and Afghanistan, Bangladesh. This is like a plant with the whole medicine in it. Okay, they use all plant parts for different condition, for different treatment. In Malaysia, we use this for skin condition, not prescription drugs, but as traditional drug. And then it contains essential oil, and if anything at all that contains essential oil, they are antimicrobial, so it's not surprising. But this one, it shows that and is against gram-positive and gram-negative, both gram-positive and gram-negative bacteria. Okay, next. All right, this is the last slide for this one. The Sembopogon. I do not know how to pronounce this, but we call it serai wangi. It's not the lemongrass that we use in our cooking, but it is full of essential oils. All this, the name that I've listed there, cyanine, terpene, beta-terpenol, alpha-terpenol. These are sesquiterpenes, which mean they are volatile, so they are essential oil and used in perfumes, as perfumes. Okay, and in Malaysia we use this as mosquito repellent as well, and we have products that in form of a cream or lotion that you apply on your skin, and then to avoid mosquito bite. And stevia is there is no indication for medication for stevia, but then they use this as a replacement for sugar, as a sugar replacement. So we have this stevioside and riboside. You can see that in stevioside you have three molecules of sugar. And then riboside, you have 4 molecules of sugar, and this only 3 molecules of sugar. The sweetness it possesses 300 times sweetness as compared to sucrose. So, which means you don't need to consume much of this stevioside to get the same taste as sugar, the table sugar that you use. So this is used as some zero-calorie supplement, diet supplement, and also by the diabetic patient to replace sugar from their diet. Okay, next. All right, so these are plants with pharmaceutical properties. They are plants that being used traditionally, and then now it was tested that they do have pharmaceutical properties. But not necessarily we know the mechanism of action, or not necessarily we know the chemicals that are responsible for the properties. Okay, so this one is sweet clover. This is used in homeopathic for very, very long time, prescribed against headaches and high blood pressure, and it contains dicumarol, but then there is no evidence that dicumarol actually contribute to the property, to the pharmaceutical properties of this plant. Okay, next. All right, so below these are some these are a plant. This is plant that produce salicylene. Salicylene is the chemical that form salicylic acid, the one that you get in your aspirin. And the name comes from the name of this willow. The name of salicylene is Salix alba. But then actually the main source of salicylene is not willow. Now is in the Queen of Meadow, the plant. So they produce salicylene, that can be convert into metasalicylate. The aspirin that you consume now, actually the active ingredient is the salicylic acid, but then it's not very friendly to your stomach. So they modify the structure, become metasalicylate, and then after you consume, and then it's absorbed into your blood system, then only it will change into salicylic acid. Then it works. Okay, so tolubasam is another plant that produces salicylene, but this one it contain because it's resin, so it contain high amount of essential oil, so they use as antiseptic. So it has also expectorant properties, so it is added into cough syrup. So witch hazel, this one is very toxic. It's not meant for consumption, so it is applied. It's only for topical application. It's contain tannin. Tannin is not okay. Tannin is not necessarily toxic, but then it's not very nice. It's not palatable. But then there's no properties on this plant to be consumed. Okay, next. Okay, sundew. This is a plant that eat ants or insects. So this sundew is used for antispasmodic. The tincture is not it contains naphthoquinone, but it's not naphthoquinone that actually contribute to the antispasm effect. But then the whole plant is used, and then it's converted into a tincture and it's used again. Is added into cough syrup. So for plasmodic cough. Okay, next. All right, so henna, this is actually used traditionally for cosmetic purpose. Okay, it contains pigment that used for hair, nails, and skin, and then people use as a fungicide and traditionally as well. And then you just crush the leaves and then put on the wound area, so it heals. It contains lawson. This lawson is actually the fungicide component, but then it was said that it was used as abortive, but we do not know because we don't use this for this purpose here. Okay, next. Okay, so this is misai kucing. Misai kucing means viscous. We have a lot in Malaysia, and traditionally people use for diuretic and kidney condition, but then it's not proven that it works. But there are some chemicals extracted from this plant, and all these chemicals, upon testing, they are not, they do not show any properties towards this said condition. All right, so now we go to the drugs from plants. Okay, these are drugs that develop from the plant. We have this mayapple. The drug is from the rhizome. Rhizome is the horizontal roots that connect from plant to plant or from the plant to the offstream. So they use the rhizome to isolate this podophyllitoxin. Podophyllitoxin, upon lab test, it possesses anti-cancer activity, but then later and it was quite well studied. They found that this podophyllitoxin inhibit the formation of tubulin. Tubulin is what to call this? The strain that form in mitosis. So to bring the chromosome in the middle of the nucleus, and then so that the cell can be divided. But then inhibition of this tubulin formation, then now it stop the propagation or the division of the cell. So it is how actually it stop the is how actually it stop the growth of the cancer cell. But then it's very toxic. It's too toxic to be used in cancer chemotherapy. All right, so this is just a little bit further about the story of this podophyllitoxin. Since it's very toxic, so now we modify the structure and put sugars, and then we have epoticide and teniposide. And this epoticide it reduce the toxicity of this compound, and it still can be used, but then for limited treatment, quite specific treatment. But then the podophyllitoxin can be used, but not for oral administration, only for topical application. Okay, next. All right, so another drug is Soralen. Soralen is from rutaceous plant. Rutaceous plant, actually any citrus plant are rutaceae, from Rutaceae family. Okay, and then this is Citrus bergamia, we call it bergamot. This is the main source of Soralen. It doesn't possess pharmaceutical properties, but this Soralen is used to make your skin sensitive to UV. It's a photosensitizing. It doesn't heal your condition, but it helps your skin to absorb the drug better. They call it PUVA therapy. PUVA mean Soralen. The P is for Soralen. UV ultraviolet, UVA, which means UVA is the ultraviolet with the bigger wavelength, the larger wavelength of this UV. So this PUVA therapy, how they do it, they apply Soralen on your skin, and then exposed to UV light for perhaps 20 minutes, 30 minutes, and then and later apply medication on the skin, so that it become more efficient. And then it was for its properties, it used to be added into a suntan cream when people use the cream and then go to the sun and they get nice tan. But then it was, I think it is already banned in many countries now, because the effect is long. You might have very bad pigmentation and it stays for a very long time. So it was not anymore allowed to be used in suntan lotion. Okay, next please. All right, so these are atropine and scopolamine. These are from belladonna plant. It's very, very potent and very toxic as well. So the name belladonna come from history, long time ago. I don't know how long, but it's very long time ago. At that time, women who works in aesthetic field, wherever they are, they use belladonna as a eye drop, drop into their eyes, and then the pupil enlarge. So perhaps the statement of beauty, or the definition of beauty at that time, when you have dilated pupil. So it is very, very dangerous. Okay, so now it is an anti-cholinergic medication, and now it used because it has some muscle relaxation effects, so you can use to slow heart rate and decrease the saliva while surgery. And then in eye drop, this is with very, very close supervision, used for eye inflammation. Uveitis is eye inflammation, and then also for lazy eyes. Okay, so scopolamine used for antispasmodic, and then used for motion sickness. This is quite widely used here in Malaysia. Okay, next. All right, so opium, this is like everyone knows this from opium poppy plant. The drug is from the latex. When you cut the pot, the flower pot, you get the latex and then dry it, and you get a huge amount of morphine, and morphine is by far the most efficient analgesic ever used in the world, and it's still being used in hospital setting now. But the extraction of opium latex is not fully for morphine use. Most of the time used to make a morphine derivatives. I just give you a few examples of derivatives. There are many more out there. So these derivatives, it may lower the analgesic effect. It may be higher for to sedate bigger animals, and it can be different way of administration. So there are many derivative of this morphine. Okay, next. All right, quinine. This is an old drug as well, and it's not much used anymore because because of its toxicity. But then in the condition where you cannot get any other malaria treatment, you may they're still available in the market for this. Okay, and then there are also some already some resistance toward this quinine, resistant by the Plasmodium falciparum. All right.
Okay, doctor, excuse me.
Yes.
Yes, we have 10 minutes left.
Okay, thank you.
Okay, thank you.
Okay, so this vinblastine and vincristine, this is also some breaking age. I do not know. I call it. It's a very huge, a very big discovery in drug history when we found vinblastine and vincristine from in Madagascar, periwinkle. This plant now everywhere in the world. It was natively from Madagascar, but then now everywhere, and then it's also used as ornamental plant in some gardens, but we need to be very careful because this plant is very toxic. Okay, and then actually traditionally people use this plant for diabetic to treat diabetes, and when they consume this plant, they found that they lost weight. Okay, and then the sugar level reduced, the blood sugar level reduced, and from that, there's the scientists take the plant and study, and they found this plant is very toxic. What happened was actually it poisoned your body, and then you get sick and you lose weight, and you don't have appetite to eat, so your sugar level is lowered. And since it's toxic, that now used for another test, which is for cancer study, and they found these two compounds that are now being used in cancer chemotherapy. Okay, next. Okay, so this is the last, I think the last slide for this. This is not actually the drug, the single entity drug is not well studied for a mechanism of action, but then this is the extract of the senmeritazole produced into a drug called Legalon, the medicine called Legalon. This is approved in some countries. And registered only for prescription, only for a prescribed drug. It was not very well proven that this extract, the plant, may heal the liver condition, but then due to desperation that we need to quickly get some medication for this condition. So it was approved, and then with very strict supervision in using. Okay, next. Okay, so now the conclusion. Conservation of plant is very important. Not only they give us oxygen, or like a common belief that, and these are a source of our drugs, of our medicine, and after thousands of years of using drugs and medicine and traditional and modern, we still need new drugs. We always need new drugs. We always need to have continuous supply of new drugs. There are new disease coming in, and even the drug that exists, the existing drugs now need to be better, need to be improved. you know, and yeah, and then not only come from plant, they might come from endophytes, from bacteria, but still if plant as an endophyte live on a plant, and then as a part of ecosystem, and we need to preserve this wild plant, because when we are talking about chemicals, we are talking about secondary metabolite. Secondary metabolite is about the compound, the chemicals that produced by the plant to protect themselves. Okay, because this secondary metabolite is not a necessity for a plant to live their life, to keep living, but then it needs this to protect themselves, to protect from infection, to deter the herbivore, to deter from animal from eating them, so these secondary metabolites, they only will be produced when the plant are threatened. If you cultivate the plant, you give them oil, not oil, you give them water, you put a very good very nutritious soil, you give them what you protect from pests, and then they might not they might not produce good secondary metabolites. Okay, so it has to be preserved in their original place, in their original habitat, and then so we can keep getting them from time to time. So with that, I thank you. I open for a question.
Okay, thank you so much to Dr. Manshoor for the insightful presentation and sharing. And now we will continue to the discussion session. So for the participant, maybe if you want to ask a question or maybe directly asking, you can clicking the raise hand button, or maybe you can leave the question on the comment section. And now we have one question right now, Doctor, from Ms. Retno Ika. Okay, and she asked about the what is it? Okay, she asked about the picture of jamu, and then she asked if it's famous also in Malaysia, because it's a famous drinking or herbal drinking in our country, and is it also famous in Malaysia? Because and the second question was if this jamu is regulated by the government and developing to phytopharmaceutical too in Malaysia. Okay, I think that's the two questions for now. Please,
Yeah, okay.
Okay.
Okay, we do have jamu. I believe they originated from Indonesia anyway. Anyway, so we do have jamu, and what we have here is herbal products from Malaysia. We have many, like mushrooming growth of traditional medicine company in Malaysia, and we do have regulation, but not at the advance of getting like what animal testing and clinical testing. No, we are not yet there, but we have regulation for quality and safety of the products. Okay, it need to pass the quality regulation, and also the safety regulation, but not yet the efficacy. Okay, as long as it's safe, then it is fine. But now the government is very recent that the government introduced this natural product with therapeutic claim. For this one, they need to go to clinical trial until phase 3 for the products. After the quality and safety, and then they need to continue to the 3 stages of a clinical trial before they can claim that they have this therapeutic effect on their products. I hope I answered that question.
Okay, maybe I want to continue the question from Mrs. Retno Ika, because
Yes,
I
please.
also have some interesting here. What I want to ask is, I mean, okay, if you said that jamu in Malaysia didn't do what the pass for the animal testing and on, maybe that's for the, what should I call it, the traditional jamu. But here in Indonesia, we have jamu that was produced in industry, and maybe that's why the industrial must have or must do the test before the product can be released to the people. So what about in Malaysia? I mean,
Okay,
do
in
you
Indonesia,
have do you have the same product, or that's just for the traditional, like mbok jamu
yeah, I understand.
delivering? Yeah.
Yeah, I
Okay.
understand. Okay, there are two types of traditional medicine in Malaysia. First is what do you call it? The first is the traditional plant, the medicinal plant, and second is herbal products. Okay, for this medicinal plant, they don't need to register. We have registration, and only product that is registered can be sold in the market. So we have regulation, and then when you conform to regulation, you can register your product. But for traditional plant, for medicinal plant, used by some dukun, some bomo, you don't need to register this, providingly they are only raw material. They are only, for example, roots or barks or dry leaves that crush. They can use this, and then for the prescription that you go and see the dukun, they give you some boiled concoction, you can use that. But then if it go to another process, which is extraction, once you extract the product, now you cannot call it traditional plant anymore. It fall under the herbal product, and this herbal product need to be registered. In order to register, you need to follow all this regulation for quality and safety, which means that the factory, the fabric that produce this need to follow the GMP, the good manufacturing practice, and then they need to they are list of laws and regulation to protect this. They are also iklan drug akta iklan ubat. You are regulated to how to advertise your product. There are things that you cannot claim in this. There are diseases that you cannot claim when you sell herbal product. You cannot say that this is for diabetic, this is for heart disease. You cannot say that. You can only say that this is good for your health, or this is for your blood circulation. You cannot claim any asthmatic or any. No, you cannot do that. These are the regulation. This is for the safety, and then there are lists of plants that are not allowed. For example, the plant that contain aristolochic acid is not allowed, and then there are also indication if this is for what I don't know, purgative. You need to have indication in the box that saying this cannot be reached by children. We have this regulation, but then we don't have this. I understand this phytopharmaceutical stuff. We don't have that far.
Okay, Doctor. Thank you so much for the explanation. And we still have one more question.
One more question, yes.
Yes. Oh, and another question. We still have two from Mrs. Nurma Sapila. She's asking about your explanation about how phytophyllotoxin is used, and why is it only used topically, or is it because toxicity, or is it still progressing as a systemic treatment?
It's because of it is because of it is toxicity. It shows in a lab, in vitro, and even in animal studies that it stopped the growth of cancer cells, the growth of the tumors, but then it is too toxic to be consumed. So for topical, that's why it's only for topical use.
Okay, I think it's clear enough. And for, I think, which one here? someone has raised the hand. Maybe before we move to Mr. Noorobby's question, you may unmute your mic, maybe if you want to ask the question directly, please. Okay. Oh, I forgot the name. Just now I saw the, okay. Okay, maybe we should move next to Mr. Noorobby's question, which is herbal medicine in Malaysia. Does the herbal medicine in Malaysia have the quality standards, or yes, or what is the standard then if it's already have the standard? Please.
Okay. I'm not really sure what does it mean by standard. Is it we are talking about ISO something? Okay, we do have a quality regulation by Ministry of Health for any product that is registered in Malaysia. And then we have apps to check whether we have many products in the market. We do not know whether they are registered or not. We have some way to check whether they are registered. If they are registered, we know that they are of quality and safe. But then if this standard, I do not understand, because if it's we are talking about the standard of the manufacturing, yes, it has to be manufactured by a GMP lab. And then for the chemical test, because there are some tests they need to produce in order to register. Tests for microbial contamination, tests for there are some tests, and then all these tests must be in a lab with certified by ISO 17025, I guess, with GLP, good laboratory practice. We have that.
Okay, doctor. Maybe for the manufacturing, it's the same in Indonesia industry. But maybe if I can ask more question, and continuing Robbie's question, because right now in Indonesia there is what is it? There is medicine that use what is it? Illegal solvent. Okay.
Illegal solvent?
Yeah.
Solvent.
So
Okay.
yeah, solvent for the medicine.
Yeah.
For the syrup, actually, for the
Okay.
syrup. And then maybe that's why Robbie asking, because does in Malaysia have the standard maybe for the solvent that has to be used for the syrup or for the herbal medicine, because sometimes we have herbal medicine in syrup. Yeah, right.
I understand. Okay. What we have, the regulation we have here is what you cannot use. Okay. Other than that, you can use. Okay. So you cannot use this and this and this in your preparation. Other than that, you can use. But if we are talking about solvent, I'm not sure solvent for extraction. If it's solvent for extraction, it fall under the GMP. If it not allowed, GMP cannot use that solvent for extraction. Is there any specific solvent that cannot be used in Indonesia? If you know?
Oh, that's the illegal one actually, because what is it? Ethylene glycol, I think.
Ethylene?
Yeah, ethylene glycol. Some product actually we detected that the product has that solvent in the medicine, so that's why we have to take out the medicine out of the
that can happen. Yeah, that can happen.
Okay. And okay, the next question, doctor, we still have from Noya. I guess she is asking what is the difference between dry leaves and tea extraction for the function. What is the difference? Okay.
The different the dry leaves is that you take the leaf and you dry, and that's all. That's a dry leaf. Extraction means that you need to use some solvent or some mean to extract out because the leaf you have is contain, apart from the chemicals, it contains also the fibers. Okay, the tannin and the other materials, the other material that you don't want. So after extraction, you will get only the chemicals from the leaves. If I answered that way. Okay. Usually in the lab we use solvent to extract out the chemicals, but then using water you can also do that. But then decoction is not considered as extraction. Decoction mean you boil in water. It's not considered as extract.
Okay, I think it's clear enough for Noya. And is there any more question? We still have some time left. Or maybe the audience, maybe you want to ask directly to have some discussion maybe with Dr. Manshoor. Please raise your hand.
Well, you can email me.
Oh yes, of course. Okay, maybe for the email. Yeah, excuse me. Okay, if I think there's no more question, Doctor, for this session, and so with the last question, and of course the last answer from Dr. Manshoor, I think we can end this third session, of course, with our incredible speaker. It was very insightful for us, and okay, once again, thank you so much for Dr. Nurhuda Manshoor for the incredible sharing, and hopefully for all the participants can or could able to gain new knowledge for us from us from this session. Okay, and for the last one, I deeply and for the last one, I deeply apologize. Maybe if I have some mistakes. And thank you for all the attendants, for your for the participations today. And now I will return this webinar to the MC. Okay, thank you so much, Dr. once again. And wassalamualaikum warahmatullahi wabarakatuh.
Okay, thank you for the excellent presentation of the material from Dr. Nurhuda Manshoor. Hopefully, the knowledge provided will always be useful in the future. Before that, speaker certificate will be carried from us for Dr. Nurhuda Manshoor. To Mrs. Widayanti, please take over.
Thank you, Atira.
I'm sorry. There's a mistake in my name, spelling my name.
Oh yes, of course. We deeply apologize.
It's okay. It's okay.
We will write it again.
Yeah,
again.
sure. Yeah.
Thank you.
Okay, Mrs. Manshoor, here you colleague certificate. Thank you for sharing your information with everyone. Okay, we can continue in the future, like scientific research or another conference. Thank you, Mrs. Manshoor.
Thank you, Mrs. Widayanti and Mrs. Dr. Nurhuda Manshoor.
Thank you very much.
Well, thanks to Mrs. Dr. Nurhuda Manshoor for the excellent presentation of the material. Thank you also to Mrs. Hanandayu for guiding the second session today. Before we close today's webinar, we ask the invited guests, committee, and participants to turn on the camera because there will be a documentation session. Alhamdulillah, we have carried out the series of this event. Now we have come to the end of the event. I would like to thank you for all the speakers who have provided extraordinary insight and experience for all of us. Thanks to the moderators and thanks to the webinar participants who have listened to the event from the beginning until the end. Hopefully, a lot of knowledge is obtained and applied in everyday life. For the winners, the best question, please contact person in chat box. I am Atira Noorobby as the MC, and Mrs. Karisa and Mrs. Hanandayu as moderators. I apologize if there are any mistakes, whether intentional or not. We say goodbye, thank you for your attention, and see you soon. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Okay.
For the speakers, if you have any agenda, please leave the Zoom.